afternoon everyone. Today I am going to present a fee paper on correlation of OCT based indices to predict the outcome of idiopathic full thickness macular hole following pars-plana vitrectomy. Paused. Coming to introduction, idiopathic full thickness macular hole is one of the major causes of metamorphopsia and poor visual acuity in elderly. OCT established the role of anterior, posterior and tangential force in macular hole development. Various authors have studied the possible correlation between preoperative OCT findings and anatomical and visual outcome. The primary objective of my study is evaluation of preoperative OCT-based parameters and their association with postoperative anatomical outcome at 3 months. The secondary objective is their association with visual acuity at 3 months in logMAR. The study was conducted in AIIMS Rishikesh. It is an ambidextrous comparative study. The study period was from November 2019 to January 2025. The anatomical outcome was divided into UV, W and non-closure type of macular holes, in which U and V type of macular hole were considered favorable, whereas W and non-closure type was considered as unfavorable anatomical outcome. Visual outcome was measured as BCVA in logMAR at 3 months postoperatively. These are the images. First image is showing U type closure of macular hole. Second is showing V type. The third is showing W type of macular hole closure. And the fourth is showing non-closure of macular hole. The patients with idiopathic full thickness macular hole who provided consent for PPV and had a minimum postoperative follow-up of 3 months and an OCT signal strength of more than equals to 7 were included in the study. The patients with secondary macular holes and coexisting vision limiting ocular pathology, along with any previous intraocular surgery except uncomplicated cataract surgery, and who didn't have adequate medical records, were excluded from the study. These were the following parameters that I measured in my study. On the right hand side, the parameters, on the left hand side, the indices which were derived using these parameters. So in the OCT SD line scan, in the first image we can see the B represents the base diameter, A represents the minimum diameter, E and F are nasal and temporal arm lengths, and C and D are nasal and temporal vertical heights. In the next image we can see that OCT SD21 line scan, in which the area which is under blue outline represents the macular hole total area, under green outline it represents macular hole area, and under yellow outline it represents macular hole cystoid space area. These all parameters were measured using ImageJ software. Coming to the results, there were total 48 number of participants with a mean age of 62.7 years. The females were more than males with the average duration of symptoms of 4 months. 42% of the number of the patients underwent PPV alone, while 6 patients underwent PPV plus phaco. And there was significant change in visual acuity from pre-op to post-op, amounting to a p-value of less than 0.001. 87.5% of the individuals had favorable anatomical outcome, whereas 12.5% of individuals had unfavorable anatomical outcome. Coming to the correlation of these parameters with postoperative outcome, in that we found that in case of anatomical outcome, only minimum diameter and macular hole height was correlated significantly with the postoperative anatomical outcome, such that the patients were having less minimum diameter were having good postoperative anatomical outcome, whereas patients having high macular height was having favorable anatomical outcome. Now coming to the postoperative visual acuity, in that we found that minimum diameter, base diameter and macular hole area were associated significantly with the favorable postoperative visual acuity, such that they are having positive correlation coefficient, which means that higher the value of these correlation coefficient, lesser will be the visual acuity. Now coming to the macular hole indices and their mean values and their association with the anatomical and visual outcome. In this we found out that MHI, THI and hole forming factor were associated significantly with the postoperative anatomical outcome, such that these all factors had higher values in the favorable anatomical group as compared to unfavorable anatomical group. Coming to the postoperative visual acuity, in that we found that MHI, THI, hole forming factor, macular hole cystoid space area index and macular area index were having significant correlation with postoperative visual acuity. In our study, the cutoff value of certain indices were different from what is established by previous studies. Like in our case, the mean hole index more than 0.35, the traction hole index more than 0.69 and hole forming factor more than 0.6 were associated with favorable anatomical outcome, which were lesser than which were previously established. So limitations of my study were that it is an ambidextrous study. Most of the phakic patients underwent PPV alone and some had combined phaco-PPV, which could have influenced the post-operative visual outcome. Also, the macular hole of all size and varying duration were included, and predictors of outcome may differ across macular hole subgroup. But subgroup analysis was not feasible due to uneven and small sample size. The microstructural changes like ellipsoid zone, external limiting membrane integrity, which could impact the visual outcome, were not assessed. The strength of our study were the single surgeon performed all the procedures, there was uniformity in the surgical procedure, and it is a single study comparing both recent and previously defined macular hole parameters. In the end, I would like to say that the integration of both established and newer OCT-based parameters, especially those accounting for multi-directional traction, is a better guide for prognosis and surgical planning in idiopathic full-thickness macular hole. Also in our study, MHI was the single most significant factor for prediction of post-operative outcome. Further large-scale studies are needed to standardize the cutoff values and to validate the prognostic relevance for newer indices. Thank you.